So you recently returned from a family vacation to the Kingdom of Saudi Arabia and you have developed a slight cough. You snuggle into your sofa with a bowl of chicken soup and turn on the evening news. To your surprise, the top story highlights recent panic over a new deadly viral infection called Middle East Respiratory Syndrome, MERS or MERS. Should you call your doctor? Should you call an ambulance? Or should you simply tuck yourself into bed after 2 ibuprofen tablets and ignore the news altogether? Like any self-proclaimed medical genius, you search the internet for appropriate YouTube videos on the topic of MERS to alleviate your concerns. Apparently, Middle East Respiratory Syndrome is caused by a coronavirus, which is a large family of viruses that cause disease in humans and animals. This is the same class of virus that caused severe acute respiratory syndrome, or SARS, in recent years. MERS was first detected in April 2012. Infection with MERS causes death in about half of cases. Okay, that is frightening.
Today, we learned that a deadly new virus has been found in the United States. The Centers for Disease Control told us that one patient in Indiana is being treated for Middle East Respiratory Syndrome, known as MERS. The virus had been seen only in 12 countries in the Middle East and Europe. Dr. John LaPook is looking into this.
The unidentified patient was a healthcare provider in Saudi Arabia. On April 24th, the patient traveled from Riyadh to London and on to Chicago, then took a bus to Indiana. 3 days later, fever, cough, and shortness of breath developed. The next day, the patient was admitted to Community Hospital in Munster, Indiana. Dr. Ann Schuckett is with the CDC.
We were working with partners in England and with others around the world to make sure that the people who were on the airplanes are contacted and notified to be on the lookout for signs or symptoms.
MERS was first reported in 2012 in Saudi Arabia. There are 401 known cases worldwide with 93 deaths. All the cases can be traced back to the Arabian Peninsula. Those 6 countries have 88 of the deaths.
The Indiana patient is in isolation, listed in stable condition. There's no specific treatment or vaccine for MERS. When it spreads from person to person, it appears to be through close contact. The CDC believes this first U.S. case represents a very low risk to the general public.
John, thanks very much.
Camels might be the source of the deadly MERS, or Middle Eastern Respiratory Syndrome, coronavirus that started affecting people last year. The virus has infected 94 people and almost half of them died as a result. Exposure to animals that have a virus is one way that it can be passed to humans. Researchers from the National Institute of Public Health and the Environment and Erasmus University in the Netherlands looked at blood samples from many livestock animals, including sheep, cows, goats, and camels from different countries. Dromedary camels from the Canary Islands and Oman were found to have low levels of the antibodies that are similar to the MERS virus, which indicates that they might have carried the virus at some point in their lives. Although this data is a lead to find out where the MERS virus came from, Professor Paul Kellam from the Wellcome Trust Sanger Institute in Cambridge and University College London said the definitive proof would be to isolate the virus from an infected animal or to be able to sequence and characterize the genome from an infected animal.
The coronavirus gets its name from the crown-like spikes adorning the virus cell. It is from the same family as the common cold and the deadly SARS virus. The coronavirus is thought to replicate by binding onto cell surface molecules and producing viral RNA strands. Symptoms include a fever that lasts for more than 10 days, respiratory ailments, and gastrointestinal ailments. So far, human-to-human transmission has been in isolated clusters in healthcare or live-in family situations. The incubation period is thought to be about 12 days. There have been 54 reported cases, resulting in 30 deaths.
Coronavirus is the cause of the Middle Eastern Respiratory Syndrome. It's a virus we can all help prevent from spreading. Please take the following precautions to prevent infection. Wash your hands with soap and water, and use antibacterial gels regularly. Avoid touching your eyes, nose, or mouth as much as possible. Use a tissue when coughing or sneezing, and discard it in a wastebasket after use. Avoid contact with infected individuals and use a face mask when doing so, and maintain general hygiene. For more information, please visit the Ministry of Health's website.